If you're interested in body contouring and you've done some research, you may have come across the term liposuction or suction lipectomy. These are words that are used to describe the removal of fat through a surgical procedure, where a cannula, which is a metal straw that has holes on one end and a vacuum hose connected to the other, and a small incision is typically made, and that cannula is used to remove fat with suction or vacuum assistance. There are all different types of liposuction techniques that are out there and available, and I would make sure that you're choosing a surgeon who does a lot of liposuction and is practicing modern techniques to make sure that you achieve the most optimal outcome. There are many areas on the body that can be treated with liposuction. Areas like the submental area, which is fat that's underneath the neck, the upper arms, the chest, the upper back, the entire circumference of the waistline, the thighs. There are many areas that can be treated with it. Is liposuction a recommended procedure for your body habitus? It really depends upon the quality of the skin and the amount of fat that is there. We expect with liposuction that the dermis, or the deeper layer of the skin, will actually have a bit of a contractile response. Once fat is removed, we depend upon that contraction to make sure that there's not skin excess that is left. Typically, the younger a patient is, within the range of, say, 20 years of age to about 35, we usually will get good skin recoil as long as there is no evidence of stretch marks or loss of skin elasticity in those areas. Good questions to ask a surgeon before moving forward with allowing them to perform liposuction on you would be, number one, are you certified by the American Board of Plastic Surgery? If you're not, why are you not certified by this board? Number two, do you have hospital admitting privileges for this procedure? If not, why not? Number three, where is this procedure going to be performed? Am I going to be awake, or is this going to involve general anesthetic? My personal preference is to use general anesthetic to make sure that the patient is comfortable and that I can get them the best result possible. Lastly, what type of liposuction technique do you implement? Do you use any technology? Do you use straight tumescent technique? Please talk to me about that and the outcome that I can expect with that. Some of the benefits to liposuction involved improved body contouring and improved self-confidence through improved contouring. Sometimes there are areas that are just stubborn and will not go away through diet and exercise. The feedback that I tend to get from my patients is that liposuction is very rewarding because it typically treats areas that are very, very stubborn and patients have been trying very hard to get rid of on their own. From an expectation perspective, you can expect to have a nice contour. You can expect to have some stiffness and some soreness after surgery that will feel like you worked out really hard about 2 days ago, and that post-workout day 2 feeling that you get, that feeling typically will last for several weeks. As time goes on, things will soften and relax, and the results will become more and more evident as you hit 6 weeks and then 3 months out from surgery. Technically, changes can actually still come as long as you're maintaining a healthy lifestyle for up to a year after liposuction.